In 1983, I was finishing my fellowship in cardiology in Boston. I'd spent my whole life training, and I had this thought of coming back and improving outcomes in my hometown. As I started paying attention to peripheral disease, I started to realize that there is an absolute correlation between peripheral vascular disease and coronary disease and carotid disease, and that if I simply checked foot pulses and found no foot pulses, even in an asymptomatic patient, that I'd identified a sick patient who needed careful care. Sick legs are almost never attached to healthy people. The very first group I decided to approach with this whole concept were podiatrists. So the very first meeting of NCVH was for podiatrists. This meeting was an astounding success. To my surprise, almost all of the state's podiatrists showed up for this, as well as many from out of state. Based on this, we thought, there's a lot more we can do because we have to reach out to primary care doctors. We have to reach out to our cardiology colleagues. We have to bring people in and talk about this message.
The vision that Craig had to go out and educate the masses through community meetings, I think is phenomenal testament to his vision of trying to change the paradigm and how we treat these patients.
It's incredibly important to educate the public, to educate physicians, to train physicians to address this really unmet need. Many conferences are dedicated to one subspecialty, but endovascular medicine and endovascular intervention really crosses multiple subspecialties: interventional cardiology, interventional radiology, vascular surgery.
I love the well-roundedness in that team approach that NCVH offers to acknowledge not only the physicians doing this, but the podiatrists doing this, and the mid-levels doing this, and the office managers that help us out to do what we do and just focus on the medicine and caring about these patients. NCVH, we're all one big family.
The idea behind our meeting is to not just teach what is, but to teach what might be. This meeting, of course, has grown into a major international meeting.
When I think of NCVH, I think of the leg meeting.
To teach the new fellows coming out, the newer techniques, to become those CLI specialists, limb salvage specialists, is key. NCVH stuck out because it was very focused for me on something I really love to do, which was peripheral artery disease. Knowledge builds skill, and over time, skill is the power that you need for your patients.
Our field changes pretty much every month, and there's new technology coming every month. There's new techniques coming every month. And if we don't have platforms like this, I don't think we can network. I don't think we have that ability to really advance the science.
The first time when I went to NCVH, Dr. Walker was very kind enough as a first-year person for me to give me a general sessions topic to talk about. And when I spoke in that topic, I looked around and I saw these people who were like who's who of the world of medicine. And I'm sitting with them and talking with them, and it took me a little while to understand that I'm sitting on the same stage with them.
Our mission statement was to create a collegial atmosphere, a fraternity where doctors could communicate with each other when they had problems. So the very first day of our meeting is the Fellows Program. And that night, we have a social called Meet the Titans. And so fellows and other doctors and people who were there can go and they can meet doctors who've changed the world.
One of the take-home messages that I've noticed from day one at NCVH is that we're all in this together. It is a place for open and free debate, open networking, an exchange of ideas in an environment that's conducive to that. No matter what area or specialty you're in, whether you're a nurse or a tech, or a podiatrist or a primary care physician or a endovascular interventionalist, whether you're in a small practice or a large practice, whether you're one of the experts or you're not the expert, you can communicate with each other freely.
The collegiality is amazing. I have good friends now across the country that I routinely call on just for expertise advice.
To me, it's developing that network of friendships that I have now acquired people that I know all over the world.
I've met a lot of people, a lot of very interesting, highly intelligent people through this meeting, and have maintained those connections with them.
We have live cases piped in from all corners of Earth. And I think that's very important because the amount of change that's occurred within the last decade is profound. Often there are things approved in other parts of the world that simply are not yet approved in America. And albeit we don't have those technologies yet, it is important for us to learn because many of those will be coming.
We can always read books, we can always read lectures, but when a live case is happening, it is happening right at that moment.
I think a lot of people love the live cases because they can see the struggles of the operator. Just to see what the operators do, what wire choices they have, what balloons they use, why they do atherectomy, why they use intravesical ultrasound, their reasoning behind drug-coated balloons, their reasoning behind not to stent, their reasoning behind using all the different modalities we have, kind of helps them kind of figure out their algorithm.
NCVH has taught me a lot about technique, doing a better intervention, doing a more comprehensive and thoughtful intervention.
All these conferences are great fun, but I think one of the important characters of NCVH is also New Orleans. We have to see that the whole city brings out this collegiality, and it gives me immense pride to be a part of this. My personal and professional growth has been so incredible.
The secret sauce is passion to keep this, keep NCVH going.
It's different every year. It stays up to date on the latest and greatest, in addition to the business of medicine.
I'm very proud of what we've achieved with U Cardiovascular Horizons. U Cardiovascular Horizons was very unique in that we wanted to not just educate one discipline, we wanted to educate all disciplines, not just all interventionists, classical surgeons. We wanted them to understand what's available. Also, we wanted to educate podiatrists about the role of vascular disorder. We wanted to integrate with diabetologists, with wound healing experts, with all of these other people so that global care of patients would be better. Our regional meetings were set up in an effort to educate people in their local communities.
Our regional meetings, these topics are being made for primary care physicians, nurse practitioners, the nurses and the techs, and each regional meeting has its own flavor. I think that truly makes NCVH special. It's not just one conference. It's a system of education that we have created.
So NCVH has been all over the world. We've put on many meetings in China and Japan and in Latin America, and we think this is important. There's a worldwide epidemic of peripheral artery disease, and we're going to see that continue.
Probably some of my most memorable experiences with NCVH have actually been the experience traveling to China, the opportunity to meet colleagues halfway around the world, seeing how skilled they were, but understanding how eager they were to learn from us, awe-inspiring on an educational level and awe-inspiring on a personal level.
Perhaps the most trying moment was the year following Hurricane Katrina when we had to move the meeting. So the Miami airport was closed following Hurricane Wilma, which hit Miami. I thought, well, this is the end of this. We're certainly not going to have any attendance. Well, I was very wrong. Over 1,200 people showed up. They flew into Orlando and they drove in. So I think it speaks volumes of the kind of importance that this meeting has to people. We've had doctors and others who had never missed a single NCVH meeting.
It's the best meeting I attend all year, I'll tell you that right now. Thank you, Dr. Walker, for trusting in me. Thank you, NCVH, for an amazing 25 years.
Thank you very much, Dr. Walker, for creating this movement for all of us where we could come, learn, and teach.
I can't wait for the next 25 years of NCVH to learn all the new tools, all the new tricks, and so that we can ultimately help our patients. And that's the ultimate goal.
Greg, I'd like to congratulate you on the phenomenal success that you have achieved. You've made such an impact on the world. It's been a pleasure to be a part of this, and I look forward to the next 25 years.
Dr. Walker, I'd really just want to congratulate you on an absolutely amazing career and look forward to many more years of working with you and learning from you.
Congratulations, Craig. You're my good friend, my mentor, and an amazing man on this remarkable anniversary. I'd just like to cheers to you, to the difference you've made and the paths you've paved for the generations to come.
I have to congratulate Dr. Walker on 25 years of a fantastic meeting, being a pioneer in this space.
Having NCVH now for 25 years is a testament to you and your work ethic. I could not be more proud to not only have you as a mentor, but as a friend. And I wish you all the best. We love you very much.
Making our meetings successful. First off, our dedicated faculty. Secondly, our attendees. And finally, I want to thank our professionals here that work with me, because they allow me the time to help to organize this meeting and put it together. This is a group effort. My dream in moving back to Houma was to create cardiovascular care that would be better for my family, my friends, and the people who I'd grown up with. Not in my wildest imagination did I dream we'd be on a world stage. I can think of nothing more pleasing than to have trained other physicians and see them excel.